Achalasia Cardia. Definition: a primary esophageal motility disorders characterized by failure of the lower esophageal sphincter alias to relax. Now, etiology: idiopathic or secondary to conditions like Chagas disease. Pathophysiology: loss of inhibitory neurons in the mesenteric plexus, impaired glossopharyngeal sphincter, relaxation and aperistalsis of the esophagus. Clinical features: progressive dysphagia, solids and liquids both, regurgitation of undigested food, chest pain and weight loss. Diagnosis: barium swallow. Okay, in barium swallow, there we will say bird's beak appearance. Sometimes it is there is rat tail like appearance. Rat tail like appearance. Okay, or sigmoid shape with rat tail appearance or bird beak. Now, esophageal manometry. Esophageal manometry is gold standard. Okay, it is gold standard for diagnosis. Esophageal manometry shows absent peristalsis and high lower esophageal sphincter pressure. Endoscopy to rule out malignancy. Now, treatment: medical calcium channel blockers. Okay, what is medical treatment? Calcium channel blockers or nitrates. Now, endoscopic treatment: pneumatic dilation, botulinum toxin injection. Okay, botulinum toxin injection should be applied on lower esophageal sphincter to relax. Okay, to relax it. Now, surgical method: Haller's myotomy. It is a gold standard for treatment. Surgical Haller's myotomy, often combined with fundoplication. Next is poem. Okay, peroral endoscopic myotomy, minimal invasive alternative. Now let's do some MCQs. Okay, question 1. Which of the following is the gold standard diagnostic test for Achalasia Cardia? Okay, here telling gold standard diagnostic. What is? We have discussed above. What is the answer? Yes, it's esophageal manometry. It is gold standard. Esophageal manometry confirms the diagnosis by showing absent peristalsis and high lower esophageal sphincter pressure, making it the gold standard. Now, question 2. What is the characteristic finding on a barium swallow study in Achalasia Cardia? What is the characteristic finding? Is the Korsakoff esophagus or Bordwick's appearance or a pulse correlation or string sign? What is this? It is Bordwick's appearance. The bird's beak appearance results from a narrowed alias lower esophageal sphincter with proximal esophageal dilation due to food stasis. Okay, sometimes the it is also called as red tail appearance or sigmoid appearance. Okay, with tail or body weight? Now question 3. Which of the following is the most effective long-term treatment for Achalasia cardia? Okay. Option A botulinum toxin injection, pneumatic dilation, Heller's myotomy, proton pump inhibitor. C. Which is the most effective long-term treatment of Achalasia cardia? It is Heller's myotomy, surgical method. Heller's myotomy. Okay. So Heller's myotomy is the gold standard surgical treatment as discussed already, often combined with fundoplication to prevent reflux. Now question 4. Which of the following is not a typical symptom of Achalasia cardia? What is your answer? Which of the following is not a typical symptom of Achalasia cardia? Okay. Dysphagia is present. Regurgitation may be seen. Weight loss may be seen. Heartburn is the answer. Heartburn is the not the answer. Not a typical symptom of Achalasia cardia. It is basically C in GRDC. Achalasia cardia primarily causes dysphagia, regurgitation, and weight loss due to food stasis. Heartburn is more characteristic of GERD. Okay, not Achalasia. Gastroesophageal reflux disease. Okay, not for Achalasia. Now question 5. What is the primary pathophysiological mechanism behind Achalasia cardia? Okay, primary pathophysiological mechanism behind Achalasia cardia. What is your answer? Okay, answer is loss of inhibitory neurons in the mentoric plexus. Okay, Achalasia results from degenerating of inhibitory neurons leading to failure of lower esophageal sphincter relaxation and peristalsis. Now question 6. Which of the following is the most common complication of untreated Achalasia cardia? What is the most common complication of Achalasia cardia if untreated? What is your answer? It's esophageal cancer. Chronic food stasis and irritation increase the risk of esophageal squamous cell carcinoma in untreated Achalasia patient. Which surgical procedure is considered the gold standard for treating Achalasia cardia? I discussed above. What is? Answer is Heller's myotomy. Okay, same question. Heller's myotomy is the preferred surgical treatment, often combined with fundoplication to prevent reflux. Now question 8. What is the role of botulinum toxin in Achalasia cardia treatment? What is its role? Tell the answer. Answer is it temporarily relaxes the lower esophageal sphincter. Okay. Botulinum toxin inhibits acetylcholine release, leading to temporary lower esophageal sphincter relaxation. However, its effects last only a few months. Okay. Thank you.